Hello, today we're going to do module 2 from the nurse delegation for nursing assistant in home care aid, a special focus on diabetic 2. We covered module 1 before, now we are doing module 2. Module 2 covers lesson 4, 5, 6, and 7. Lesson 4 is about insulin basics. I am on your book on page 54. Insulin therapy must be individualized to the needs and priorities of the client. No single insulin regimen is appropriate for all people with diabetics. Everybody is different. Basal insulin and bolus insulin are the two types of insulin that control blood sugar. Basal bolus insulin therapy is a form of insulin treatment that's designed to mimic the natural patterns of insulin release seen in a person who does not have a diabetic. So some clients may be on just basal insulin, while other clients will be only on bolus insulin order. Other clients will be prescribed basal bolus insulin therapy. So insulin is available usually by injection, by pen, syringe, or insulin pump, or inhaled. Let's talk about basal insulin. Basal insulin is long-acting and helps keep glucose level stable during the day and throughout the night. Also known as the background insulin, keeps blood glucose levels consistent during periods of fasting, usually taken once or twice a day depending on the insulin, and it is a long-acting insulin. The bolus insulin, on the other hand, is a short-acting insulin that works rapidly in control blood sugar. Bolus insulin controls spikes of blood glucose after our meals. Hence, bolus insulin is also known as mealtime insulin or prandial insulin. Bolus insulin is to act quickly, so it's two types: short-acting insulin or rapid-acting insulin. So those two are bolus insulin. This lesson 4 is very short. It just talks about very insulin basics. It's only one page in the book. Lesson 5 talks about types of insulin. There are many different types of insulin on the market, and they work in different ways after being administered. The differences are composed of how quickly they work, when they peak, and how long they last. Insulin has 3 characteristics. One is onset, and peak time, and duration. Onset is when the insulin is at the maximum strength in terms of lowering blood glucose. Onset is the point at which the insulin first starts to the lower blood glucose, the first one. And peak is when the insulin is at the maximum strength in terms of lowering blood glucose. And duration is a period of time the insulin is lowering the blood glucose levels. And here it's showing us a comparison. This comparison of equal amounts of different type of insulin. This is the insulin effect, and this is the times that's shown us in a picture. If you see here, the rapid acting one is the peak is for the rapid one, the peak is 1 hour. It takes 1 hour to peak, and then its onset is 15 minutes, and duration is 2 to 4 hours. And if you look at the short acting one, the onset is 30 minutes usually, and the peak is 2 to 3 hours. The duration is 3 to 6 hours. And if we look at the intermediate acting, and the onset is 2 to 4 hours, peak is 4 to 12 hours, and the duration is 12 to 8 hours. If you look in the long-acting one, the onset is several hours after the injection. It doesn't have a peak and it works about 24 hours. There are also insulins that are not shown in this picture, pre-mixed or fixed combination. Their onset is 5 to 60 minutes and their peak is dual and the duration is 10 to 16 hours. Or the other ones are ultra long. They're like long acting, but they're a little bit different. Their onset is 6 hours, and the peak, they don't have a peak, just like the long acting. Their duration is 36 hours. They are more than long acting. They stay more. And the book shows us a table so we can understand it better. Okay. Insulin types are classified according to their onset, peak, and duration. There is a rapid acting, short acting, intermediate acting, long acting, premixed, and combinations. So the rapid acting insulin. Rapid acting insulin are very clear, intended to control postprandial or post-meal blood sugar. Their onset is 15 minutes and peak is 1 hour and duration is 2 to 4 hours. Some rapid acting insulin currently available are listed here in your book and here, right here. Okay, let's go to the next one, short acting insulin. The short acting insulin are regular insulins or regular human insulins. Their onset is 30 minutes and their peak is 2 to 3 hours and the duration is 3 to 6 hours. Rapid acting is administered at mealtime, not like a short acting. The brand names for short acting insulins usually are Humulin R or Novolin R. Intermediate acting insulins. NPH is one example. And NPH insulin has a cloudy white color. And the solution must be, when we are using NPH, the solution must be gently and thoroughly mixed before the injection is prepared. To mix gently, roll the container or vial, pen, or pre-filled syringe between your palms several times. If you see any white clumps floating in the solution after mixing, or if the butter has a frosted look to it, do not use it. The intermediate acting insulin, their onset is 2 to 4 hours, and their peak is 4 to 12 hours, and their duration is 12 to 18 hours. And some brands for NPH are Humulin N, Novolin N, Rayalon or Novolin. Long-acting insulin. This type is often combined when needed with rapid or short-acting insulin. Long-acting insulin products are very clear. Their onset is 2 hours and they don't have any peak, and they work 24 hours and some of them a little longer. There are 3 forms of long-acting insulin on the market right now. Insulin Deramar, the generic name for Levemar, insulin Glarigon, the generic name for Lantus, Bazelor, Toujao, insulin Deglodic is the generic name for Tresiba. See, pre-mixed insulin. Not all insulins can be mixed together. There are several pre-mixed insulin on the market. When mixing insulin in a single syringe, the rapid-acting or short-acting insulin should be drawn up first, usually taken 10 to 30 minutes before breakfast and dinner. Their onset is 5 to 60 minutes, and the peak varies a lot, and the duration is 10 to 16 hours. This type of pre-mixed insulin form, there's a lot of pre-mixed insulin nowadays. It's been a while since I've seen a vial on work, to tell you the truth. Most of them they come pre-mixed already. They say like Humulin 7030, Novolan 7030, Humulin Mix 50. These are what their names look like. It's like a combination. Let's look at inhaled insulins now. Inhaled insulin is a newer insulin approved by the FDA in 2014. The inhaler is similar to the one people with asthma use, where insulin is released as a fine powder that's breathed into lungs. There, it enters the blood through a tiny blood vessel. Inhaled insulin is pre-measured, ultra-rapid acting insulin taken at the beginning of each meal. Inhaled insulin peaks in about 15 to 20 minutes, and it's out of the system in 2 to 3 hours. Inhaled insulin is delegatable. You can get a delegation on it. Some advantages to inhaled insulin that are listed in your book are, they act very quickly and effectively, and as an injectable rapid-acting insulin, the clients can take it at the beginning of the meals, and it lowers risk of low blood sugar and might cause less weight gain. It's not an injectable, so it might be a good alternative for people who have a fear of needles, and it can easily be taken in public or outings. The disadvantage of these inhalers are it might cause mild or severe coughing, may be more expensive. They still require injections or a pump for long-lasting insulin. Dosing isn't as precise, not recommended for people who smoke or have lung disease such as asthma or COPD. There are some medications that are working for insulin but are not insulin. They're non-insulin injectable medications. There are other medications beside insulin that require injection and are called non-insulin injectable medications. While not considered insulin, these injectable medications work in a similar way as insulin, therefore can be delegated just as insulin is delegated. There's some examples in your book. These are non-insulin injectable medication, and they are listed in here on your book. There's two main ones, incretin mimics, this is one, and another one is amylin mimetics. These are they're very similar. There's different kinds that are listed on your book. Let's see. This one in endocrine mimetic. This type of medication works by increasing the level of hormone called incretins. These hormones help the body make more insulin only when needed and lowers the amount of glucose being made by the liver when it's not needed. They can help lower appetite by slowing the rate of digestion. Amylin, on the other hand, these are injectable medications, is a human-made form of hormone called amylin. When the pancreas makes too little insulin, it also makes too little amylin. Amylin works in three ways. Through its action on the brain, it provides a feeling of fullness after eating. This may cause individuals to eat less, resulting in weight loss. And second, amylin, it slows down how quickly food leaves the stomach. This helps to reduce the rise of glucose after meals. And the third one is amylin. It stimulates, it limits the amount of glucose that's released by the liver, especially after meals, when extra glucose is not needed, through a reduction in how much glucagon is secreted after a meal. There's two kinds, like type 1 and type 2. Type 1 is a 15 mcg injected just before meal, and type 2 is 60 mcg injected just before major meal. Usually, is amylin must be warmed at room temperature before injecting, and we don't mix it. And we're not supposed to inject it into the arms, or it's only supposed to be injected into the abdomen or legs. We're not supposed to freeze it. We can refrigerate it, unopened medicine until expiration date on the label, but we have to warm it before we use it. Generally, when the storage is, we're not supposed to use it, froze it in the freezer, but we can put it in a fridge before we take it out. So when we are using this amylin, if we are using oral antibiotics or contraceptives, we should be taken 1 hour before this injectable medication. Or if a meal is missed, it's recommended a dose is skipped. If the resident has missed a meal, report immediately to your supervisor and the delegating RN, and follow the employer or facility policy on missed medication. Now let's go to lesson 6. Seems like we got through it already. Lesson 6, insulin storage. Insulin must be stored properly to ensure that it remains safe and effective. Improper storage could result in the breakdown of insulin, affecting its ability to regulate blood sugar. Depending on the type of insulin prescribed, there may be some differences in how best to store it and how long it will last once open. The general rules for insulin storage, it's listed in your book very nicely. If it is unopened, unused insulin vials should be refrigerated between the temperatures 36 to 46 degrees Fahrenheit. You can store most opened insulins at room temperature for a maximum of 28 days. It's best practice to sign and date a new vial of insulin once it has been opened, include the discard date on it too. Keep insulin pens refrigerated until you open them. After that, you can store them at room temperature. We do not freeze insulin. Some insulin can freeze at the back of the refrigerator. Please mind that. Do not use insulin that has been frozen. Frozen insulin should be discarded right away. And keep insulin away from direct heat and sunlight. Do not leave it outside in extreme heat, above 86 degrees. Exposure to the sunlight can degrade or break down insulin. Always check the expiration date and do not use expired insulin. And you also need to inspect your insulin before each use. Look for change in color or clarity. Look for clumps, solid white particles, or crystals in the bottle or pen. Insulin that's clear should always be clear and never look cloudy. How do we handle insulin? Before using insulin, like in vials, pens, or cartridge. How do we handle them? So we have to perform hand hygiene all the time. Mix the insulin by rolling the vial between your palms if it is a mixed insulin, of course. Do not shake containers as it causes air bubbles. And the rubber stopper or multi-use vials should be cleaned with an alcohol swab before each use. Wipe at least for 5 seconds and let air dry without blowing on the stopper. Before using, check the insulin to make sure it's clear. These are like general guidelines. Okay, now let's go to lesson 7. Seems like we're done with this one. Insulin dosing. Insulin is measured in units. The standard and most commonly used strength in the United States is U100, which means it has 100 units of insulin per milliliter of fluid. Recently, we have like U500 insulin has been developed for people who are extremely insulin resistant. U500 insulin is 5 times more concentrated or powerful than standard U100 insulin. The doctor may order insulin dose to be administered in one of the 3 ways. One is a fixed dose or set amount. When a medical provider orders a fixed dose or a set amount of insulin, the person with diabetic will get the same amount of insulin at the same time every day. Example, give 15 units regular insulin at 7 a.m. each day, the same thing. The second one is a sliding scale. Sliding scale orders means the person with diabetic will be administered a dose of insulin or extra units of insulin based on the results of their blood glucose test. There is a table here. It shows you exactly if you know what the blood sugar of the client, you come look at the chart and you take the insulin that's appropriate for that blood sugar for the person. The third type is insulin to carbohydrate ratio. Insulin to carbohydrate ratio is used to give insulin based on the amount of carbohydrate a person eats at the meal. Example, the order might say administer 1 unit of Novolog insulin for every 15 grams of carbohydrate that's eaten. Like that. Some foods they have you have to know exactly how much that person eats to apply this. And the last one from our model is correction factor dose. A medication provider may also order additional units of insulin to be administered with the sliding scale insulin if the client has unusually high blood sugar. This is called a correction factor, which is how much 1 unit of rapid-acting insulin will lower blood glucose. If the client has a correction factor ordered as part of their insulin regimen, the nurse delegator will review with you. This is how it's supposed to be done. All right, thank you very much. We'll see you next time. Thank you.